Okay, today we're going to be talking about psychedelic drugs. Psychedelic drugs are kind of a weird class of drugs in that they all have a general effect, but the cause of their effects are very different across the different classes. So let's start off talking about what psychedelics are. They're any agent that causes alterations in perception, cognition, and mood as its primary actions. Sometimes these drugs are referred to as hallucinogens or psychotomimetic, which basically means they make people psychotic or make them hallucinate. Most people tend to refer to them as psychedelics or hallucinogens. This is, of course, where discussions of the psychedelic era come from. The 60s often referred to as the psychedelic era. One of the biggest problems from a pharmacological perspective is trying to classify these drugs. We classify them based on their function. We have the anticholinergic drugs, which is primarily scopolamine, the catecholaminelike psychedelics, which include drugs like MDMA or ecstasy, the serotonin-like drugs such as LSD and psilocybin, and the glutamatergic NMDA receptor antagonists, which include PCP and ketamine. Let's start off talking about scopolamine. And scopolamine is a variant or derivative of deadly nightshade, which is belladonna. One of the other major components of belladonna is atropine, and atropine from belladonna was once used to dilate pupils, the idea that it would make women more attractive. Interesting side note, when you are attracted to somebody, your pupils dilate automatically, so it's a social cue that you're attracted to somebody. So this was a way in which to try to get people to find them attractive because their eyes were dilated. At any rate, scopolamine is very similar to atropine in its structure. Interestingly, this drug was associated with sorcery, magic, witchcraft, and aphrodisiacs, and the reason for that is people who had ingested this particular substance reported sensations of flying, and so that's one of the reasons why it's associated with sorcery and witchcraft. Scopolamine has a variety of pharmacological effects. It acts on the peripheral nervous system to produce an anticholinergic effect, which causes an increased heart rate, dry mouth and constipation, and blurred vision, much probably owing to the fact that it also dilates pupils. If you've ever had your pupils dilated at the eye doctor, you can't see anything afterwards. There are central nervous system effects, which include drowsiness and amnesia. In fact, this drug is oftentimes used to cause amnesia in surgical patients. At high doses, you can get a psychotic-like syndrome. Scopolamine is also sometimes used as a motion sickness drug, although I haven't been able to find any evidence for its efficacy for that. It's well known for being used for that. In fact, it's usually a scopolamine patch. But that's scopolamine. It's, again, causes drowsiness and amnesia, or its primary central nervous system functions, including, along with its psychedelic effects. The catecholamine-like psychedelics are going to include things like mescaline, which is also known as peyote. Mescaline has a long history of use in Native American cultures. In fact, it's legally available for use in religious ceremonies for those who are part of the Native American religion. Its pharmacological effects include and persist for approximately 10 hours, so it's a very long-lasting drug. It is not metabolized before it's excreted. It's actually excreted whole. Its effects primarily involve dissolution of ego boundaries, visual hallucinations, including colors, shapes, and animals, and dimensions of boundlessness. This is the idea where people can go on sort of a mind trip. This is thought to be part of Native American rituals involving finding your animal guide and other types of experiences. So it is associated with visual hallucinations and the sort of dissolution of self, where people believe that they are connected to everything. So that's mescaline. Our other major catecholamine-like psychedelics are the synthetic amphetamine derivatives. We're going to talk today only about MDA and MDMA because they are the ones that are used the most. They're similar in structure to mescaline and methamphetamine. MDA is a more potent version of MDMA. We'll talk about MDMA, which is methylene dioxymethamphetamine, more commonly known as ecstasy. It's important to understand that ecstasy has a dose-dependent serotonin neurotoxic effect. It causes a huge serotonin cascade. It can burn out serotonin neurons just from overuse. It does induce a sense of disembodiment and visual distortion. It's also associated with greater impulsivity and lack of control. The initial serotonin cascade is followed by reduced available serotonin and subsequent mood reduction, particularly about 2 to 3 days following use. So if it's taken on a Saturday night, by Tuesday, the person who has taken it that weekend is feeling particularly bad. It's very important to understand this drug also causes a dysregulation of homeostasis, in particular the systems governing temperature and thirst satiety. Anyone who's ever been to a rave will know that it's incredibly hot at these events because everyone there who is taking this drug is giving off so much body heat. Importantly, the thirst satiety is what's associated with the potentially dangerous effects of ecstasy. The very few deaths associated with its use are usually due to people drinking too much water and getting what's called water intoxication. All of the electrolytes get flushed out of their body and they end up having a heart attack. So ecstasy affects both serotonin and norepinephrine. The symptoms associated with it include teeth grinding, muscle tension, nausea, depression, anxiety, panic, mental confusion. Over time, there's more tolerance to the positive than negative effects. The potent and selective neurotoxin in animals and humans, and damages the serotonin neurotransporter. The acute effects of ecstasy include heightened perceptions, reduced appetite, stimulation, and elevated mood. The adverse effects of ecstasy include clouded thinking, hyperthermia, disturbed behavior, and jaw clenching. So that's ecstasy. The final catecholamine psychedelics include myristicin and elmicin, which are basically nutmeg and mace, which are available from your grocery store. Ingestions of large amounts of these can cause euphoria and hallucinations, but can also be dangerous. Let's turn next to the serotonin-like psychedelics, the primary one of which is LSD, which is lysergic acid diethylmide, which was synthesized in 1938. Later, Timothy Leary became its primary proponent. LSD has some very unusual pharmacokinetics. It's taken orally in very, very small doses. This drug has potent effects at incredibly small doses. 25 micrograms is the average dose. This is the reason why it's usually put either in candy or on stamps to be lit, because you want such small doses. You get peak concentration after ingestion in about 3 hours, and it can last for about 6 to 8 hours. This drug has very limited physiological effects. In fact, it has a very large, safe range of use, from 25 micrograms to 14,000 micrograms. In fact, it's very unusual for someone to have any kind of overdose effect. What tends to happen is people tend to have psychotic episodes from the use of this drug. And that's why the psychological effects are the most important. You get alterations in perception, thinking, emotion, arousal, and self-image. Time can be slowed or distorted, and you get sensory input being intensified. Visual hallucinations are very vivid and most characteristic. And one of the interesting side effects is people are able to visualize things that they know what look like in their mind. And so you get these increased ability to visualize, which is part of how the visual hallucinations take on their form. So that's LSD. A very similar drug is psilocybin, which is contained in wild mushrooms. These mushrooms are consumed. The dosage will, of course, range widely and have similar effects to LSD. Our final drug to talk about are PCP and ketamine. PCP, which is also known as angel dust, causes profound psychotic states which can be induced by its use. PCP is very rarely used either as a drug of abuse or any other state anymore. Ketamine, however, is still used in anesthesia and also a drug of abuse. Most people obtain it from veterinary sources, either from stealing it or just buying it outright. The liquid drug then is dried to form a powder, which is then snorted. This is a drug that tends to be used as part of raves and nightclubs. This results in hallucinations and disinhibition and can be incredibly dangerous when combined with alcohol. Okay, well that was our very quick and brief introduction to psychedelics. Our last topic will come up next, which is anabolic steroids.